I would like to let everyone know that the attendees do not have a microphone feature on the webinar. If you have any questions, please do utilize the chat box feature or the Q&A feature, and we will answer all questions at the end of the webinar. Our speaker today is Dr. Maria Madrid from South Texas Health Systems, a bilingual family medicine physician with more than 17 years of experience caring for patients. Dr. Maria Madrid provides healthcare services for everything from acute illnesses to metabolic and cardiac health diseases. Thank you so much for joining us today, Dr. Madrid.
Thank you.
Let me go ahead and stop sharing. There we go. Awesome. Thank you.
All righty. So are we ready?
Yes, ma'am.
Okay.
Go ahead.
All right. So thank you for having me here today, and happy to be here. So today I was asked to talk to you about going from pandemic to endemic. So we're in that transition period. So transitioning from the pandemic to the endemic. I am Dr. Maria Madrid, and I practice family medicine with South Texas Health Systems. Just wanted to go through pandemic and endemic definitions with you. A pandemic, basically widespread occurrence of the infection, and it's over a whole country, or in our case right now, the entire world at a particular time. So COVID-19, right now we're in the COVID-19 pandemic. What does it mean to be endemic? That is a disease that's always going to be present in a specific population or in a region, and it's expected to stay there indefinitely. COVID-19 is not there yet, but researchers believe that it will be. An example of an endemic is malaria, which is common along the equator, hot tropical zones, especially in Africa. So there are vaccines that are available for malaria that you can look at and talk to your health department, local health department, if you're planning on traveling to different areas of the world. So pandemic versus endemic. We can't move forward without looking at the past, okay? So that's what we want to do. I'm going to give just brief background of the coronavirus. So as you can see here on the coronavirus in my background picture, the coronavirus gets its name from the little projections that come out of the surface of the virus that make it look like a crown. Corona is crown, right? So that's where this group of viruses gets its name from. So now this group of viruses, without getting into too much detail, this group of viruses thrives. It loves to infect people, and it loves to infect a lot of people, because when it does that, it starts changing its insides so that then more people get the infection. And that's what happened with COVID-19. So it started, started as COVID-19, and then we had the Omega variant, and then we had Delta variant. There were so many variants because so many people were getting sick. And so this virus that's what it thrived on. And that's why it spread so much, because of the way that it works in the body. COVID-19 is also known as a severe acute respiratory syndrome coronavirus, and COVID-19 is the second one. So SARS-CoV-2, the first one was actually in 2002. There was another SARS type virus in the Mediterranean area in 2012. So coronaviruses are not new, but we had never seen anything along the lines of COVID-19. And it was identified to have started in Wuhan, China. Again, just a brief refresher here. Clinical manifestations of our COVID-19: cough, fever, chills, muscle aches, the fatigue, the headache. Wait a minute, this sounds like the flu. It sounds like when I get sick with strep, right? That's why we didn't know. We didn't know. And patients would come in the beginning or call in. And so do I have strep? Do I have flu? Well, nobody was running any tests back in 2020, right? Because the test didn't exist. And people would joke, so am I sick, or am I flu sick, or am I coronavirus sick, right? Because a lot of these symptoms are all the same. The one that I always ask my patients about is trouble breathing, because trouble breathing is the #1 indicator of hospitalization. So I tell my patients, do not mess around. If you have any trouble breathing, you need to get yourself to an ER as soon as possible. So we can take care of cough, fever with other medicines, but the virus itself, and maybe I should have talked about that. Viruses, you can't kill them. There's no medicine. Bacteria, we have antibiotics. When it's a virus, there is really no medicine to kill the virus. The virus, because the virus attacks, it enters our own cells, and that's where it starts duplicating everything. And so we can't kill our own cells. That's more along the lines of chemotherapy, right? And that's some strong medicine. So viruses, we have to wait until they kind of stop reproducing inside our cells. But while they're reproducing, they're causing all of these problems. What are the risk factors for COVID-19, other than obviously the transmission and how easily it was transmitted? But we're going to look in a little bit at some numbers. Advanced age, so over the age of 65 is what we were looking at. So that's a risk factor. Obesity, having a BMI, which your doctor checks, having it above 30, which for women is usually about more than 150 pounds, for men more than 185, depending on your height, right? So ask your doctor to let you know what your BMI is if they haven't talked to you already about it. And then we worry about people who have other illnesses regardless of their age. So hypertension, diabetes, anyone who has heart disease, who has had a heart attack in the past, especially people with lung disease. If you have COPD from smoking or from asthma, you want to be careful. And then of course our patients with cancer, because their immune system is already low. We're going to look at the numbers now. I kind of started backwards here, but our current US population, and this is as of like May the 5th, around there, we're at about 335 million. I just rounded off there, but that's the exact number from May 5th. So 335 million people in the United States. We've had almost 82 million cases, and of those cases, almost 1 million people have passed away. I just saw on the news today that President Biden was going to have some sort of a memorial for the 1 million mark. I started medical school in 1998. I'm aging myself, but I started in 1998. I graduated medical school 20 years ago this May, and so the first 2 years of medical school were more lectures. So I wasn't in the hospital setting. But the last two, so total in a hospital clinic setting, 22 years, I have never seen the amount of death that coronavirus caused. I've never seen where we needed freezers to hold people who had passed away because they were passing away so fast. It was scary in 2020. Funeral homes that could not keep up with the demand and had to hold patients, or patients had to be cremated because of the illness. It was definitely a life-changing experience for everyone. Excuse me, I didn't know I was going to get this emotional. But the death was real. The death was real. So when we look at, there are people a lot smarter than me who look at the numbers and look at all kinds of systems, all kinds of different things to determine what we're going to need in the future. Here we have the data based on race, and this actually surprised me. This surprised me. So we have in the red are the cases, the blue is death. We live in the Rio Grande Valley. It's all Hispanic, majority Hispanic. So all we were hearing about was the death of Hispanics, right? I expected this to be a lot higher for Hispanics and African Americans. But as we can see here, it was the Caucasians, and here they say white. It was the white population that had the most cases, and they had the most deaths, and not because there's more in the population, right? Because the gray numbers, the gray shadow boxes show the percentage of Caucasians in the US. And so I was surprised, but this is what we learned from the pandemic, because unfortunately it was the Caucasians who did not want to get their vaccines. We're going to go into vaccines in a little bit, but some smart people were looking at these, and that's how we developed the vaccine. And we have amazing computers and science now that we were able to develop that vaccine very quickly, despite what lots of people were saying. We won't go into that, but the numbers don't lie. These are the numbers. And it was the Caucasians who had the most cases and who passed away from COVID. Then we're also looking at death by age group cases. So cases are in red, death by age. And this is the sad part too. 65 and over. Oh, I can't see with my glasses. Sorry, I'm at that age. So 65, right over here, right towards the bottom. 65 and over are the least people with the cases, is the population that had the least number of cases, right? So at the bottom, the last three little bars in red. But when you look at the deaths, they were the ones that were dying. So the last three in blue, so very few people were getting sick, but those few people were all dying. And so we lost a lot of our elderly population to COVID, unfortunately. But that's where they started talking about the vaccines. And that's why the vaccine was aimed at those 65 and over first because they were the ones that were dying at a higher rate than anyone else. You can look at all kinds of different things. Cases in red over here, 18 to 29-year-olds. It was actually the most. That's your young kids, your college kids, young adults who didn't want to stop doing what they were doing. You know, when you get to my age, I'm in the 40 to 49 age group, married with children, and I was going to do everything to protect my family. You know, when you're 20 years old, you don't have a family and you want to go out and have some fun. And so those young adults were the ones getting the most infections based on this graph, but they weren't dying. If you look at the blue, they were one of the least. So 18 and really 29 and under, very few deaths. So this graph, along with the other one, are truly amazing and help us understand what happened and the reasoning of why this group of people, who's getting vaccines first. I don't know if you remember in 2020, I heard a lot of deaths, probably because of my age group, right? We had friends of friends. The men were the ones passing away, 30 and 40-year-old men with young children, young wives who were now widowed. And that's what you can see here in deaths by sex. Men died more than women. Women get more infections, but they're not dying as much as men. So it was that way. What was happening here in the Valley was happening all over the US. Men are dying from COVID at a faster rate than women. So again, I've kind of been weaving everything together. What have we learned? We've learned vaccines work, masks work. I don't argue with anyone who doesn't want to wear a mask. I stay away from you. I'm vaccinated. My entire family is vaccinated. My parents are vaccinated. My parents are 82 years old. I don't want them getting sick. So vaccines work, masks work. We're gonna talk about that next. So right here, the CDC recommends that everyone above the age of 5 and over get their primary series of the COVID vaccine. Pfizer is the only company that has a vaccine for anyone under 18. So that's 2 vaccines. 2 vaccines, and then anyone over 12 should also get their booster vaccine. Some people, everyone over the age of 65, again, because of the death rate, should have their second booster already. So we have 3 different COVID vaccines: Pfizer, Moderna, Johnson & Johnson. Moderna and Johnson & Johnson have different, so Johnson & Johnson is only 1 vaccine in its series. Moderna is 2 vaccines in the series. And Pfizer has 2 vaccines in the series. Let me see if I can get to another screen. I had my daughter showing me last night, they're 7th grade and freshmen, how to do a Zoom and how to share my screen. I know medicine, I don't know this technology. Let me see if I'm able to, yes. So I wanted to show you some numbers of the vaccines. So this website, if you go to CDC website, Centers for Disease Control and Prevention, type in COVID, and their information is truly amazing. Can y'all see this?
Yes, we can see the
Perfect.
yes website.
All right. So over here in the corner, we can see 82.7% of people 5 and over have had at least one vaccine. That is truly amazing. And that is why we're seeing much less numbers and then much less deaths too. We go down here. Let me see. So what does that equal to? So that was one vaccine, fully vaccinated. We can look here, and on this screen it shows we have at least, so remember our population was 335 million. There are 220 million people who are fully vaccinated in the US. This is just the US. To be protected, the population should be above 60% vaccinated to protect the area. So we're at 66% of the population. And you can see the numbers there. Over the age of 65, where we had the most death from COVID-19, those numbers are at 90%. So we are saving our older generation. My daughter, 7th grade, when the vaccine came out in July, last summer, for that age group, her birthday, July 12th, that's what she wanted to do on her birthday. So she was real proud and I was proud of her to get that vaccine. Back to the PowerPoint. So now what do we have here? So bottom line, we want to stay up to date with our COVID-19 vaccines. Again, I have all my vaccines. I don't have my second booster yet, but I don't work in the hospital. I think if I worked in the hospital, I would get my COVID vaccine, but I have Pfizer, so I have my two vaccines plus my booster. And I've never gotten COVID. My family has never had COVID. My parents have never had COVID. We enjoy staying at home. But now my children are involved in activities. My younger children do a lot of sports activities. Right now, everything is outdoors. So I feel comfortable not wearing my mask outdoors. If I'm indoors in a gym and there's a large group of people, I will wear my mask. And that goes to the bottom here. You can choose to wear a mask anytime as an additional precaution. My daughter just this morning, she's a freshman in high school, and she was helping me with the presentation, getting it all on Zoom and everything, PowerPoint. And she said, Mom, nobody wears masks at the high school anymore. So I asked her, do you? And she was like, yeah, I do. Unless she's eating in the cafeteria. She said, but in the classroom, I wear my mask all the time. So that's her choice. And nobody tells her anything. I recommend wearing a mask on public transportation, especially in airplanes. That air gets transferred back and forth throughout the cabin. You're not out in free air. And so, can something be transferred? I don't want to be around that area, right? But that's my decision. So Wear a mask on public transportation is a recommendation. To get tested if you have symptoms, because we don't want to be spreading the infection. So fever, cough, cold, is it COVID? I don't know. Come on in and we'll get you tested unless you have your tests at home. But get yourself tested. If you have symptoms, wear a mask. Masks are here to stay. There is no doubt about it. I didn't talk about flu numbers, but the flu, so we were talking about COVID numbers, death from COVID. It was at 1 million almost. In the same time period, the flu only killed 65,000 people. So that's the difference. Flu was 65,000 in the same 2-3 years, and COVID-19 was 1 million. So masks work. I think whenever anyone is sick, especially in schools, or you're going to be handed a mask, put on your mask or go home, right? So that, again, we don't get anyone sick. So wear a mask if you have symptoms. If you have a positive test, you should definitely be wearing a mask. Or if you've been exposed to someone who has had COVID-19, you want to get yourself a mask until you get a negative test. That is it for me. I know in the chat there's some stuff going on, but
Yes.
again, I'm not talented.
No worries. We'll take care of it. Let me just go ahead and share my screen, and then we'll go ahead and get started with the Q&A. Okay. Is this my thank you slide? I cannot see. Nope. One more. Oh, okay. We'll just go to this one. There you go. Okay, so we do have a few questions. Thank you. First of all, thank you so much, Dr. Madrid. What a powerful presentation that was. Those charts, those numbers were something to see, and really seeing it kind of all laid out there. It really, even more so, you know, lets us know how scary and how, you know, intense these last 2 years were, and how, you know, vaccines and masks have really allowed us to move forward with our lives and potentially continue that moving forward as well. So thank you for that. We do have a couple of questions. So somebody asked if there was any news, if you are aware, for vaccines for children that are less than 5.
I know it's in the works. I have not heard when, but again, if we look at the numbers, I don't know that that's a priority, because granted, one child is losing, one person is a lot, but because, again, if you look back at the graphs, there were less than 1% of less than 0.01% of children who were, especially under 5, who were dying from the vaccine, from the COVID. I'm sorry.
Right. Okay. Yeah. Perfect. Thank you. And then somebody else asked, after having COVID, what kind of long-term symptoms and effects can one expect to experience?
So COVID, and I didn't put it in here, COVID attacks certain receptors on your body that are found in the heart, that are found in the lungs, they're found in kidneys, found in the gut. So when it could be any organ that had those receptors that gets affected. I had patients whose liver tests went out of control when so we had to change medications because the medications were doing fine before COVID, but then COVID irritated the liver. And so we needed to stop the medicine for a little bit. So it ranges from wherever the system was attacked. Lungs, if you look at the lungs, after having COVID pneumonia, especially if you were intubated, your lungs, I don't know, I don't have that many patients who required hospitalization.
Mhm.
But lungs, I've treated a lot of bronchitis, and bronchitis takes 6 months to recover from, and that's not even pneumonia. So COVID pneumonia, I cannot imagine. I would expect at least a year for that lung to get back to not even normal, but to get back to a point where you can walk around the grocery store.
Right. Yeah, that makes sense. Somebody asked about hair loss being a symptom
Mhm.
of COVID, an extended symptom. Is that something that you've seen as well?
Yes, a lot of women have lost their hair. Again, because these cells that are being attacked, SARS is, so the name SARS,
Mhm.
it was, so you're attacking all these organ systems. The skin is an organ system too.
Mhm.
And whether it's rashes, some people got rashes, or it was the hair loss. Um, but pretty severe hair loss definitely was a factor with with a lot of women,
Mhm.
and so it's going to take some time to recover from that because the inflammation can stay in the body for a while.
Right. Okay, thank you. And then I know we have a few questions regarding the vaccines and boosters. Excuse me. Would you say that there is, I know we have, that's for the Pfizer and Moderna, it's the 2 doses, and then we've had a third booster, or a third dose as a booster. Do you see a fourth booster coming in? Is that something that people can already get?
Um, so fourth shot, second booster.
Yes, I would say the
Yes.
second
Mhm.
booster.
Yeah. Yes. I say the same thing. When my patients come in, I'm like, oh, they have their all three vaccines. One is a
Mhm.
booster.
Yes.
So right now, yes, 4 are recommended for 65 and over and healthcare workers. Um, Again, healthcare workers who are more involved. I thankfully, or I wasn't involved in hospital care. Those were the real heroes, the heroes who were in the hospital. I'm a physician, yes, and I took care of patients who didn't require hospital care, but it was the ones in the hospital who who are who are the true heroes because they were in the, and so they should get the vaccine as well, in
Mhm.
addition to those 65 and over. Um, and I think what's going to end up happening, I haven't read, but I'm pretty sure that it becomes endemic, and it's going to be like the flu shot that you get every year. I have never had the flu either, and I get my flu shot every year. So vaccines work. The only time I did get sick was my first year right out of residency when I worked at a pediatric office.
Oh, wow.
Children are, they wipe their nose, and so when you look at schools and how these kiddos did not get sick, masks work because all I saw in that clinic was strep and flu and stomach infections, and I was sick that whole first year. And then, I got used to everything and formed some mechanisms to fight off these infections. And then I didn't get sick, but I never got the flu. Um,
Mhm.
so I didn't talk about hand washing, but I always wash my hands. I wash my hands if I need to blow my nose, and I wash after. So I don't put my hands on my face. I never have. I wash
Mhm.
before patients, I wash after patients. Um, and so I'm sure that has a lot to do with why I don't get as sick with
Mhm.
treating adults. And mostly now I treat adults.
Right. Okay. Yeah, definitely. Somebody did ask, well, there was one person that asked if you still think that getting a third vaccine, or the first booster, third vaccine, is still necessary if somebody hasn't received it already.
I am pro-vaccines, all vaccines from babies to adults. If you haven't had your booster, I think you should. And it's just going to protect you and your family more. It's not going to hurt you. And that's what worried a lot of people. It was too fast, and I'm not going to let them test on me. But it was the healthcare workers who were able to get it first. And I'm glad the healthcare workers stepped up to the plate and said, we're gonna get our vaccines so we can show everyone that we talk the talk, like we walk the walk too, and we get our vaccines. I have all my vaccines. Again, I don't have the other booster, the second booster yet, but I don't work in the hospital and I'm not over 65 yet.
Yes, no, that's great. Yes, no, I'm fully vaccinated as well, and I'm always encouraging others to get vaccinated as well. I guess going over to some other ways of helping us stay healthy. Somebody asked, does taking vitamin C, D, and zinc and other supplements really help in keeping someone from getting sick?
I know
I guess
that
preventatively.
I know that was recommended in the beginning for COVID. Get all of your get all of your supplements on board. So vitamin D especially is more for bone health, but we've been finding out more that vitamin D helps throughout the entire body with hormone production. So in my testing in my clinic, everyone has low vitamin D. I am surprised when I find a normal vitamin D in someone who isn't already taking vitamin D. Everyone is low in vitamin D. It is helpful to be in the sun, but our sun is so hot and we wear sunblock. Hopefully everyone wears sunblock. Or we cover up and we wear hats. So the sun really isn't penetrating our skin. We don't live in Wisconsin summers where it's nice 70, 80 degrees and the sun isn't beating down on us. We live in Rio Grande Valley sun and it's hot, and we don't go out between the hours that are like 11 and 2, right? Is what they recommend. Unless, and then if you do, you're wearing long sleeve shirts. Men who work outdoors on the streets, covering their heads and necks, because the sun is brutal. But so vitamin D is definitely recommended. I'm not familiar with a lot of the other supplements. We don't teach that in medical school. But as long as you're following directions on the bottles, not taking more than that, and you definitely don't want to waste your money and take less than that. You want to make sure you're reading directions, following directions, so that you get the full effect of the medications.
Right, definitely.
Of the
Well,
supplements.
thank you. Yeah. We do have, we'll just do one more question. Somebody asked, are the side effects just as strong on this next vaccine as they were for the first two and booster? So I'm assuming they mean for the fourth vaccine.
So if you had a reaction with any of the vaccines, unfortunately, it probably means that you will probably have that same reaction. So plan maybe Thursday or Friday to get it.
Yeah.
But I've also seen where people who had COVID already have the worst reaction to the vaccine because their body are. So vaccines work by you introduce antibodies into the system, and the body starts reproducing those antibodies so that when you get the infection, the body attacks it right away. It recognizes it. So it's going to attack it. So when you have that kind of reaction, honestly, I wonder, am I protected? Because I didn't have a reaction. Several of my friends who had COVID did. And And I'm wondering, man, sometimes I want that reaction so I can know that my body's fighting.
Yeah.
So that's good to know that when you do get the reaction, you know that you have those antibodies and your body's already attacking that infection.
Mhm.
Okay, so don't
Okay.
be, I haven't had the reactions, and I hear they're pretty bad, the body aches and the fevers.
Mhm.
But it's 24 hours, 48 hours, and then you're protected, and it's better than being in the hospital intubated with COVID pneumonia for sure.
Definitely. Definitely. Well, wow. Thank you so much for such a great presentation
Thank
on such an
you.
important topic. And we definitely, I know this is really well, this topic is definitely something that we really wanted to cover, and I'm glad that it was done. Thank you for doing it so well. Well, we're going to go ahead and round out this webinar. So thank you everyone, or thank you Dr. Madrid for the presentation and for being here.
Thank
And thank you
you.
everyone for your participation. This does conclude our 7th webinar of the 2022 Hidalgo County Employee Wellness Fair. Be sure to check out the rest of our online platform or join us in person at the Precinct 2 Indoor Sports Complex. If you have any questions, message us through our chat feature or email us at hidalgocounty.wellness@co.hidalgo.tx.us. And we'll see y'all very soon. Thank you.
Thank you so much. Thank you.
Yes, thank you. Bye-bye.
Bye-bye.